Despite the government shutdown, the Affordable Care Act, or Obamacare, is now in effect. Kathleen Gemeiner is the project director for Ohio Consumers for Health Coverage. Kathleen, healthcare sign-ups started at midnight overnight.
It did.
You've been on the site. Any hiccups so far?
It's running a little slow this morning, but it's still very user-friendly. If you go on to www.healthcare.gov, just put in Ohio, it takes you to a place to set up an account. Big fonts, easy questions, very consumer-friendly in that regard.
It is kind of confusing. Who should be signing up? Who should be looking at this website?
Well, people who are uninsured are primarily the folks who need to go to this website. If you've got coverage from your employer, most likely you're fine. Medicaid, you're fine. If you're a person with a disability or senior on Medicare, you're fine. So there's hundreds of thousands, though, of people in Ohio who don't have coverage, and this will be a great opportunity for them to find affordable coverage.
If you're about to go on the site, do you need to have any paperwork with you, any documentation? What do you need to know?
Well, it's a good idea to have some information with you, particularly your earnings. It's going to ask you what you're likely to earn in 2014, because that's the tax year that we're working with. So you really need to have that information. You should have your Social Security number, but there's not a lot of other information that you need to have.
What are you most excited about with this plan?
I am most excited that people who have been frozen out of the health insurance market for years because they have a pre-existing medical condition now can get coverage. Not only get coverage, but coverage that's affordable for them. People who haven't been able to afford coverage for years will now have the opportunity to get health coverage. That's what I'm excited about.
What kind of questions have you been getting from people? Because I'm sure you're getting a lot of questions.
Oh, a lot, sure. Most people want to know what's it going to cost, when does it become effective. I like to let people know that they have until December 15th to actually select a plan and make their first month's premium payment to still be covered by January 1st of 2014.
How much time should people block out to get on the website? A couple hours? A couple minutes?
You know, I think they should plan on sitting down when they've got an hour, and they create an account so they can come back. But I think an hour is a good amount of time. It might take longer for people who want to really look very, very carefully at all the plans, all the doctor networks, all of the prescription drug formularies.
And the site is open right now. Kathleen Gemeiner, thank you so much for coming in this morning. We appreciate it. If you have questions about healthcare signups, ABC6 is on your side. So is Fox 28 with the phone bank today. Volunteers will answer your calls from noon until 7.